Welcome to the Spring 2023 edition of the DHHS Heart of Excellence Award recognition. I'm pleased to share the names and brief stories of the recipients for the Spring 2023 awards. We once again had some tremendous nominations. The award for connection goes to Michael Loveridge, a youth development specialist with the Division of Juvenile Justice and Youth Services. Michael created a greenhouse and a garden for the students at the Day Skills Intervention Program in Springville. Michael teaches the students at DSI, which plants grow in Utah, how to plant and transfer seedlings between the greenhouse and the garden, and how to care for the soil in growing plants. The garden helps students learn and apply life skills, biology, and science. Michael goes out of his way to use the garden to connect with students and to ensure that they have all the equipment and materials for the plants to thrive. Michael's dedication to the garden not only benefits the students, but also the DSI staff and local community members too. Thank you, Michael. Next is the award for impact. We're recognizing Amanda Barr, Internal Support Coordinator Supervisor for the Division of Services for People with Disabilities. Amanda is a tremendous asset to her division, helpful to multiple teams, and always willing to support others. This year, Amanda has led a team of specialists bring a record number of people into services. As part of that process, she worked with the Request for Services Committee to streamline her approvals. Her work has ensured individuals coming into services have accurate budgets that truly reflect each individual's health and safety needs. In her work, Amanda also demonstrates the department values of empathy, accountability, support, and efficacy. Feedback from assessments she conducts is consistently positive, and she's beloved by the team she supervises. She ensures everyone has a chance to contribute during team meetings, and she collaborates with other teams to develop services that are delivered efficiently and effectively. Kudos to Amanda. The award for empathy goes to Tracy Barkley, an eligibility policy and constituent affairs specialist for the Division of Integrated Healthcare. Tracy provides customer service for Medicaid and CHIP members who have complex concerns or complaints. She's the primary contact for complex issues within her program and often works with members who are upset. One member she served nominated her for this award. Tracy is known for showing empathy and respect to those she works with and for going the extra mile to find answers for their questions and concerns. Not only has Tracy's incredible work been recognized by her teammates and supervisors, but the members she assists regularly ask to speak with her supervisor and provide positive feedback too. Congratulations, Tracy. Next is the award for innovation, which goes to Jennifer Watts, a senior business analyst for Medicaid operations within the Division of Integrated Healthcare. She took charge in creating and providing training to DHHS staff about key verifications in the new provider reimbursement information system for Medicaid, PRISM. In addition to providing tutorials about key verifications, Jennifer was available every day to assist the team members, and she checked every key verification for accuracy. Jennifer's team members praised her leadership skills, her passion for the project, and her teaching abilities. Her incredible work improved PRISM's efficiency through reducing key verification backlogs while simultaneously managing incoming key verification requests. Thank you, Jennifer. The award for equity goes to Andrew Butcher, a Spanish-speaking post-adoption worker for the Division of Child and Family Services. Andrew volunteered to handle 2 additional foster cases to help the short-staffed Tooele office. The children's mother, held in a federal immigration detention center, risked losing parental rights because she couldn't complete reunification. When a possible out-of-state kinship placement was found, Andrew asked multiple agencies to conduct background screenings before finding a willing local law enforcement agency. He also planned a visit for the children, which included the mother recording stories to help a daughter overcome her fear of flying. When the placement failed, Andrew found the immigration agent handling the case and secured the mother's release in time for her to reunite with her children. Throughout the process, as he navigated multiple systems, Andrew always showed compassion and never gave up, all while carrying his own caseload. Congratulations, Andrew. Next is the award for accountability. Kellen Musso, a senior psychiatric technician with the Utah State Hospital, excels within her own job responsibilities and willingly takes on additional work to help others. On any given day, Kellen can be found working with the floor alongside the psych techs to provide phenomenal care. For example, she'll serve breakfast while it's still hot, which allows the other techs to help with medication or bathing. She has a wealth of knowledge and a great rapport with patients, making her a valuable resource for everyone in the unit. She's organized, reliable, and always calm, and places the well-being of patients as her foremost concern. Kellen's nearly 20-year impact on the state hospital is immeasurable, and she deserves to be recognized. Thank you, Kellen. Our award for support and our new employee award is Holly Frischnecht, Grants Program Manager for the Division of Child and Family Services. Holly has been instrumental in the implementation of nearly 20 grant programs for domestic violence survivors, sexual assault services, and strengthening families. Her focus on developing positive working relationships ensures these grants have the greatest impact and has improved trust with recipients, especially Utah's federally recognized tribes. Recently, Holly has been working on grants for tribes to use for child abuse prevention programs. When planned virtual meetings with the tribes proved impractical, she offered to travel to meet their leaders and staff. This has resulted in hours of driving time, often on short notice, but has resulted in 6 of the 8 tribes applying for federal funding, when in past, no tribes would apply or receive funding. This is just one example of how impactful Holly has been in her first year with the division. Thank you, Holly. And now I'm pleased to present the award for efficacy to Brian Larson, an operations and logistics coordinator with the Office of EMS and Preparedness. Brian worked as the logistics chief during the COVID-19 pandemic. Brian also manages the DHHS COVID-19 Distribution Center and the Office of Emergency Medical Services and Preparedness Warehouse. His work during the COVID-19 pandemic helped to distribute over 71 million items, including PPE, sanitizer, COVID-19 test kits, and medical supplies to local public health agencies, hospitals, laboratories, and schools. Brian is known for his positive attitude, willingness to take on new projects, and innovative problem solving. During the pandemic, his innovation and leadership helped the state to overcome supply chain interruptions, manage federal distributions, and provide logistical support to emergency responders. Thank you, Brian. Our first team award goes to the asthma program in the Division of Population Health's Office of Health Promotion and Prevention. The Utah Asthma Program, UAP, offers the Utah Asthma's Home Visiting Program. The Home Visiting Program teaches patients how to manage their asthma at home. So far, more than 350 households have used the Home Visiting Program and have shown a 75% decrease in asthma-related emergency room visits. Accessibility is a high priority for UAP, so they work closely with their partners like the University of Utah, Intermountain Healthcare Primary Children's Hospital, and Select Health Insurance to make home visits covered by insurance. When communicating with the CDC about UAP, one of their partners said, "They are the best state partner I've experienced in my 27 years of public health. Congratulations to the asthma program." Our second team award goes to the Community Transition Waiver Team in the Division of Services for People with Disabilities. This team helps people with intellectual disabilities and related conditions move from facility-based care to home and community-based services, HCBS. The team was notified in January 2023 that an intermediate care facility serving people with significant medical issues would be closing and 30 people needed to be relocated quickly. The team worked tirelessly, and within 2 months, every resident had been moved into community-based services chosen by the person and their families and teams. This was a Herculean effort that went well beyond their job expectations. Throughout the process, the team remained empathetic and reassuring for the residents and their families. They did extraordinary work with the people impacted by this facility closure, and it exemplifies their commitment to the people our department serves. Congratulations. Thank you again to all of the recipients who have demonstrated what our department is all about, helping Utahns have fair and equitable opportunities to live safe and healthy lives. Thank you for your nominations, and we look forward to receiving more next quarter.